Well, thank you for inviting me, and I'll try to figure out where's the best place to stand, I guess, here. And I really appreciate the invitation, Christine, and I've had a lovely time meeting with the faculty here, and I've never been to USC, so I really appreciate it. And I was saying I actually don't mind the long flights. I get a bubble to do stuff that I don't often get, and so I actually appreciate it. But I am going to be talking about some work that I've been doing for a while now on social innovation related topics. And so let me start by situating kind of like where this work came from. A few years ago, I wrote a series of cases on social innovation, actually. One of them was in the Mayo Clinic and their effort to start a Center for Innovation. We had another one on kind of a mini-grid solar power enterprise in India. So we had a series of social innovation cases. And one of the things that jumped out at me, especially when I was doing the Mayo Clinic case, which is an archetypical story of things that I'm sure you all encountered in your work, it was like, well, you know, on the one hand, the Mayo Clinic is an incredibly successful, effective, innovative organization. Almost all of us know who the Mayo Clinic is. And it has kind of a really good structure for innovation. And you know, they have unparalleled innovation record around treatments and around kind of like, you know, what they've done. They've been one of the pioneers of patient-centered care for like before even it was even a term, right? They were already doing it. And so on the one hand, they're an incredibly effective and innovative organization. On the other hand, they were talking about how they felt that they were really lagging behind in terms of how much innovation they needed to be doing. It's like, what do you mean? You're one of the top 2 or 3 most innovative healthcare systems in the world. But like, no. We do really good innovation within the current business model of healthcare. But when we look at the grand challenges of healthcare, they all come from the fact that the business model of healthcare is screwed. Like, we can see that it's reached its limits, and we need a new business model, and we're nowhere near doing enough innovation there. So we need a different type of innovation, and it's around this kind of like grand challenges of healthcare, right? And so that was the premise more than a decade ago, which is when we wrote the case. And so they were like, no, we usually are very physician-driven and committee-driven approach. For this type of innovation, this doesn't work because we need to be able to innovate beyond the business model. And so that means that we need kind of system-level innovation. They were very clear about that, very smart about talking about it. And they said, like, for this, we need a different type of set of actors, right? We need to bring in designers and administrators and nurses and other staff and the communities and insurance companies and clinics. Like, all of these people need to work together to try and kind of like address this grander challenge. And we need to take a different approach, a more of a design thinking approach. And again, they were very sophisticated about talking about it. These are very effective, smart people who have been amazing at driving innovation. And you know, when you follow these approaches, and I'm sure you've done a ton of these, when people talk about what they want to do, they imagine and they plan that it's going to be something like this, like a jazz ensemble of experts coordinating, working together, and all jamming, and right? And then we plan for this, and what ends up happening is we wish it was herding cats. Right? It'd be easier if it was herding cats, right? And there was a former president of Mexico who used to say that governing Mexico was like trying to herd turkeys from a horse, right? It was like, there's just no way you're gonna be able to do it, right? And it feels like this. And kind of like writing these cases about social innovation, I was just drawn to how motivated people were, how sophisticated they were in understanding the nature of the problems, like the quality of the actors that they brought to the table and the methodologies, how conversant they were on what needed to be done. And yet, the natural state of these collaborations was that they broke down. Almost all of them, right? And so I was like, so that's interesting, because these are smart people. What's happening? And so that was the origin of this research project, working with the Hewlett Foundation, because they had long been, like the way they framed it was around evidence-based policymaking, which ends up being very similar to what I just described. Like they were saying, like, we've been talking about innovation in policymaking and evidence-based policymaking for decades, everybody says that they're committed to it, and it never happens. Like when you actually look at like, did you integrate evidence into practice? It rarely happens, and the evidence was there, and the people knew about it, but somehow it didn't make it into the practice. And so that was the puzzle that they had, which was very consistent with this puzzle that me and my co-authors had. And so that's when we decided to do this research study. And so what we did was, first, we conducted a first wave of interviews with kind of like international development experts, right, who were working in this area of like grand social innovation challenges. Researchers and funders and intermediaries and policymakers and implementers, just to get a sense for like, from their perspective, why things were breaking down and why the natural state of these collaborations was for them to break down, even when you had the best intentions, money, actors, etc. And also, we worked with them to identify good candidates for doing in-depth case studies. Right? That was one of the key things that we asked them during this first round of interviews. So then we did a second round of a bunch of interviews where we did 8 in-country case studies of the candidate. Like they gave us a bunch of candidates, then from them we selected a kind of 8 case studies that we wanted to study in depth, and I'm going to describe them a little bit more in a second. And so we conducted because there are 8, like 161 looks very impressive as a number until you realize that it's 8 cases in 4 countries, and then when you start doing the math about interviews per case, then it makes sense, right? And so we did that in phase 2, and then when we came back from, well, let me talk a little bit about those cases. So we decided to do 4 countries and trying to do kind of like match pairs of interventions that had been more or less successful. It's not like none of these were spectacularly unsuccessful or uninterestingly unsuccessful, right? They were just unsuccessful. Like when you ask the people who were involved, they were like, yeah, that didn't go how we wanted it to go. It wasn't like we can talk about it, we're not embarrassed by it, and we certainly tried, but it didn't go as we planned, versus there are some of these that were quite successful, in some cases more successful than they anticipated. And so we had these match pairs of like more versus less successful within countries. And what we wanted, like kind of our selection criteria where these are grand challenges that require multi-sector, multi-organizational innovation, where you had kind of like good funding, like you had not just a good amount, but you had serious funding of an agency. You're like, all right, that's a serious funding agency. This is a serious effort. And they had a method, an approach, and a theory. Like they all had to be serious about this, right? And so that was one of the selection criteria. And then we obviously wanted to kind of try to match for size and types of programs so that we could have interesting commonalities versus variation. And so these are our 8 cases, and I'm going to go through them relatively quickly, but please interrupt me. And so in South Africa, we had 2. We had one which the idea here was like South Africa was continues, but back then one of the biggest critical points was unemployment in youth. Like the percentage of unemployment amongst especially young, like black young men was critical. So they really wanted to figure out better programs to address youth unemployment. The evidence pointed to kind of like a variety of potential bottlenecks in the kind of like training to applying to jobs, to getting interviews to jobs, kind of like value chain if you want. And so they had some hypotheses for places where they wanted to intervene. And so that was that program. Fuel was another South African program where their idea was that even though there was funding and infrastructure to provide lunches for children in school, when you looked at the percentage of kids that were actually receiving a lunch on time in school, it was like nowhere near the funding that was being provided. And so the idea was like, well, we need to find a better way to deal with these school nutrition programs in a better setup. So that's that one. Then in Ghana, we had one that was a teacher community assistance initiative, which is kind of a remedial education program for primary school children. Here, the problem was that children, especially in rural schools, kept falling behind the grade level standards for math and reading. And there was a lot of international evidence for the potential of remedial education programs to help with this. And so the idea was to bring in kind of like a really evidence-driven and evidence-based program for remedial education. And then the other one in Ghana was the Graduating the Ultra-Poor program. So here, for a number of years, Dean Carlin and other economists from the Innovations for Poverty Action Network had been working on kind of intervention, like poverty alleviation interventions that were more integrated, meaning they had conditional cash transfer programs coupled with some training for people to do some entrepreneurial ventures, coupled with some assets. For example, in some cases, maybe in some communities, the assets that made the most difference in sense was livestock. And so depending on the community, you got some assets that coupled with some training and some cash could really help people kind of set up a much more stable economic kind of infrastructure that would get them. It was called the graduation program because there was some evidence that as opposed to the kind of like poverty alleviation programs that had happened in the decades before, these programs really help families graduate out of poverty, meaning they got to a place where it wasn't precarious anymore, where a small setback wouldn't like kind of like completely demolish their economic structure. So that was what that's why it was called the graduation approach. And here the idea was that they had done some experiments in some countries. They had found a set of components to the intervention that worked. And now the Graduating the Ultra-Poor was one of a series of randomized control trials that were being carried across the world to test the graduation approach more rigorously across many countries to see kind of like if it truly worked, et cetera. So that's the Graduating the Ultra-Poor. Then in India, we have Pratham, Teaching at the Right Level. Pratham was the organization that first identified, developed, tested, and grew the remedial education program that actually Ghana had learned about and wanted to test, right? So they are the original organization that had figured out how to do this remedial education program well. And the one that we studied was one iteration of the program, relatively like, around 2016, which is when we were doing these interviews. And so we were looking at Pratham. This is one of the most successful evidence integration organizations in our lot. Like they really have done amazing social innovation throughout their history. And so we really wanted to understand how they did things. And we contrasted them with Aqua Plus. Aqua Plus was a technology for water purification. As you know, drinking water quality is a huge issue, especially in rural India. They had bumped into a new technology that had been developed by a Swiss NGO called Antenna. And Antenna was looking for in-country partners to kind of like deploy their technology. And Aqua Plus was brought into India by a company called Tara, who are, you might know of them, like they are incredibly well known for having innovated on a number of things across the years. For example, they were the ones who we wrote the case about. They had been very innovative in developing kind of like micro solar grids and finding a sustainable business model for that. And so throughout their history, they had been very successful at finding business models for innovations that should be brought to the bottom of the pyramid communities. And so Antenna thought they would be the best partners to bring Aqua Plus into India. Hint, they actually failed in really interesting ways, partly driven by their prior successes. So that was the second India company. And then in Mexico, we looked at two federal government programs that had been carried out with some years in separation. One is Progresa. So Progresa was a conditional cash transfer program that has been historically incredibly successful, that it was copied all over the world because of its success. Actually, Progresa was the methodological origin of the Graduating the Ultra-Poor. This program kind of like is a direct descendant of the Progresa program. And then we contrasted it with Programa Primer Empleo, which was a federal government program that sought to subsidize the hiring of people who are just graduating from university, because kind of like in South Africa, in Mexico had still has a crisis of youth unemployment, but especially for people who are just graduating from college. They have a hard time finding, from college and from vocational school, And so the idea was to subsidize the fees that companies have to pay for hiring people and promote employment that way. And so these are our 8 case studies that we contrasted. And in each of them, I'll tell you kind of like a little bit more what we did. But before I move on, I know I gave you a ton of information, and so I want to pause and get your...
Terrific, fascinating. What I'm trying to get a sense of, are they all a similar stage? So it sounds like they have an idea that they have some evidence that works, and is it more about, are these scaling endeavors? Are they testing?
In all of the cases, all of these cases, they've happened in the sense that we already know what we wanted to do, and we already know what happened, right? So that's one thing. Second, in all of these cases, there is some evidence that leads them to the idea that that's the direction in which we should go, with different degrees of clarity on what that would mean. But in all of the cases, there was some prior evidence that signaled that if this is what you want to do, that's the direction that you need to go in. In all the cases, the idea was that depending on where they chose to start, the intention for all of these was at the very least national scale. Okay. So all of these interventions, that's one of the criteria, right? All of these interventions, the goal was like, this is not like we want to discover what works in one community. No. We are seeking scale, like in all of the cases, right? I think those are the 3 most common things. And all of them kind of interject with policy to some degree. In some cases, it's from policy that they start. In other cases, it's that they need to interject with policy in order to be effective.
And you mentioned you've got successes and failures. Did the subjects themselves describe that? And was there some sense of what failure meant? Right. Or is this kind of part of the...
And in all my research, I'm usually very allergic to defining outcomes myself before I enter. Mm-hmm. I tend to kind of say how do you define success, right? Let me understand how you defined success and whether you thought you were successful. And that's what we did here. And so one of the most common questions throughout our whole process is what did you want success to look like? And why did you or did you not meet that? What we found was very consistently across everybody, they define success on 3 kind of dimensions. Because again, this is about social innovation and evidence integration. They were all right, we all wanted to scale. We wanted to find a solution that scaled. That was one of the ways in which they measured success. And so if we didn't scale, we didn't succeed, right? Second is, because it's about social innovation and finding what works, we want this to disseminate. We want to not just do something that works, but we want to teach other people in other places what works. And the third is we want to become better through time in driving social innovation processes and integrating evidence into practice, right? And so we want to develop more capacity as members of whatever coalition we are to do this in the future. And so those are the 3 kind of dimensions on which they measured success. And then we categorize the cases on the degree to which the participants describe that they had succeeded in these 3 categories. Does that make sense?
Yep. Perfect.
And they were all designed with a comparison or control?
No, not all of them had RCTs. Some of them did. But all of them wanted to have rigorous evidence as part of the process. But one of the really interesting things, I'll come back to this, but one of the really interesting things is that it turns out that for some components and for some types of challenges, RCTs are not that helpful, actually, right? So one of my favorite quotes in the interviews is actually an economist, a randomista. They call themselves randomistas, people who've become really religious about everything has to be a randomized trial. If it's not a randomized control trial, then you're doing nothing. A randomista actually criticized the religion of RCTs because he was saying, listen, RCTs are very good for some things, but they're really bad for other things. And the way he said it is RCTs measure, are very precise at measuring nothing. And what he meant was there are elements of implementation that end up mattering often much more than the things that we are able to measure in an RCT that, of course, fall on the wayside of an RCT by design. How we manage things, how we implement things, like who was the person on the field and how were they managing things matters a lot for implementation success, and that usually falls through in an RCT. And so one of the interesting things that I'm going to talk about in a minute is the more successful interventions, we're able to say there's not a hierarchy of evidence. There are bodies of evidence, and then there are different types of evidence that are most informative for different aspects of the problem that we're trying to solve. In some other interventions, they just stuck to the hierarchy of evidence that was very similar to the hierarchy that they had established between the actors. And then usually that broke down because it turns out that you ignored a really important piece of evidence that you should have brought in to, right? And so I would say that in all of the cases, there was some experimental component to some of the evidence, but it was weighed very differently in different cases depending on how they thought it fit with the remainder types of evidence that could be integrated into the process. Does that make sense? I don't know if I overcomplicated my answer. I'm sorry.
No, you didn't. Because I know some of the cases, because I teach program evaluation, and some of it was like they were designed from the government in order to like prove that it was working. Yeah, like Progress is one of, aren't they?
Well, I mean, they didn't want to prove that it was working. Yeah. They wanted to first learn what would work, and they were very experimental in their approach to making sure that before they made massive investments, that they could demonstrate that that was the right direction. And they pivoted a couple of times, actually, because the evidence wasn't pointing in that direction. The same with Pratam. Pratam has done a number of RCTs, but they pivoted a number of times based on the evidence that comes out from the processes. All right, so anyway, we did that, and then we have a whole process of comparing within cases. And then at the end, after doing all of these and the analysis, then we went back to a different set of experts to, again, sit down with them and say, like, here's what we found. Like, here's the kinds of things that we're finding. How does it resonate with your experience? What else are we missing, et cetera, to kind of validate and also deepen the findings that we got from these first two phases. And so that's kind of the process that we followed for the data. I don't think it's the best use of our time for me to go very in-depth into the methods of analysis for the qualitative data that we did. I'm happy to if you think that it's worth it, but at this point, I'd be happy to jump into kind of like how we handled the cases and then what we learned, unless you want me to pause. Okay, thank you. So basically what we did for each of the cases is, imagine the mess of data that this is, right? Like, this is like,
Overwhelming amount of data.
it's just so much data and so interesting and so deep and so fascinating. And so we really have, there's so much in here that is interesting. But the first thing that we did is we just did a timeline for each of these cases, right? And so this is a very summarized timeline. The timelines that we have are way more complicated than this, but this gives you an idea, right? And so we have timelines, but we also have actors. And we have what different actors are doing at different stages and what challenges are emerging at different moments, and then how are they dealing with them and who's responsible for dealing with what and how they're interacting. And so the first pass of making sense was just do the timelines for each of the cases and then have the 8 timelines. And again, what actors were involved, what were they doing, et cetera, and what challenges emerged, and then how did they solve or didn't solve the challenges, and then what happened after and what happened after, right? Based on this, we wrote an in-depth case study for each of them that had the timeline and then had the key elements and the key challenges and the key approaches that were used. We also had, we worked a lot on, how do we understand the relationships between the stakeholders? Because obviously the relationships between stakeholders were kind of really important. And different programs decided to establish very different types of relationships across stakeholders. And so we have different ways of mapping how the stakeholders related to each other. And so, for example, this is the case of Pratam, where of course Pratam is at the center, but they have established really long-term and valuable partnerships where they have given, the size of the bubble here is how much weight are the other actors given in the intervention. So there's some interventions where the central stakeholder is the only big bubble, and they have a bunch of tiny bubbles that are just orbiting around them. Pratam, what you'll see is that they integrate a lot of actors, and there's a lot of other actors that they actually give a lot of weight, and they have a lot, very intense relationships with them, even though they still have kind of a constellation of actors that they engage with, but in a more kind of ad hoc or smaller basis. And so hopefully this gives you an idea for how, like, the kind of things that we were looking at, and again, this all translated into like lengthy case memos that we then basically use to say, all right, what are the key challenges that emerge when the people are trying to innovate together? What are the different approaches that the actors followed to address the challenges that emerged? And then based on what they decided to do, what happened next and what happened next? And you can imagine that there's some path dependency, right? That what we found was, and I'm going to talk about this in a second, but what we found is that they all ended up facing relatively similar challenges at relatively similar stages of the intervention. But some of them pursued very different approaches to how they addressed those challenges. And depending on whether you did that in one form or the other, that sometimes put you on a path that was very difficult to recover from. Versus if you did that in the ways that we were going to describe, that actually set you up really well for the next one and for the next one, right? And so that's kind of like how we went about making sense of all these data. And so now I'm going to talk about kind of like the findings. So in general, again, trying to make sense of the data, what we found is that with caveats and with imperfections, et cetera, but in general, the actors in our programs described a process that was very similar to how designers describe their process of design, right? And so if you kind of abstract from the messiness of what they're describing, you can really categorize the stages of what they were describing they were trying to do into the basic stages of any design process, which is like you need to frame the problem, you need to frame the solution, you design a process for how you're going to address this, you design a project. That project leads to some prototyping and evaluation, and then you move on to implementation in general, right? And so in general, our interventions fit really well into this with kind of like two important differences. One is that within organizations and within typical design processes, the problem framing kind of like, you already know what problem you're working on because it's given by your client or by your boss or by like, there's a design brief, right? The designers are giving a brief and it's like, here's your problem. And so usually they need to frame it, but the problem is kind of relatively well identified. In these cases, there wasn't a frame problem. They started with a galvanizing issue. There's an issue that we want to address, and then we need to figure out what this means and how we frame that problem, right? And so if you go back to all the cases that I was describing, what brought together all these people and actors was an issue. It's like, oh, we care about youth unemployment, or we care about remedial education or like educational outcomes for children. And so there's a galvanizing issue that brought people together. That was one big thing. The second big difference in more complex innovation, which not all of our cases realized that they would need, is that there has to be a big moment of redesign. Because, and I'm going to talk about it in a second, but that kind of like looping back, there needs to be, the successful processes need to have a moment of like, maybe the way we were thinking about this was all wrong and we need to go back. Sometimes all the way to problem framing, sometimes to solution framing, right? And there needs to be some looping, which again is different from traditional design processes where you do a little bit of looping here in prototyping and evaluation, but there's not that much revisiting like how we were fundamentally thinking about the problem because the complexity is different, right? So those are kind of like two big differences. But now once we have this as the general set of steps, again, what we found is that our participants, all of them, in all of our cases, were super successful people who had been super successful in the past, doing all kinds of things, and that's how they ended up doing these bigger things, right? And all of them described being surprised at some point by why this was so much harder than what they had done in the past. All of them. They couldn't quite explain why, but they were all like, I had done this so many times before. And then they described it, what we were thinking was like, yeah, that's not really the same thing. Like what you did before was actually easier, but I see what you mean, why you thought you had done this effectively in the past. so this is now our interpretation of the data. What they were describing, but they were not realizing that they're describing, is that when they all had done this in the past, they had all done it inside of an organization, working on a problem that kind of like was contained within that organization. So the Mayo Clinic, which is not one of our cases, but just as an example, people who've worked on the big challenges of healthcare in the Mayo Clinic had all been really successful at driving all kinds of innovation with the Mayo Clinic. When they described, like, we've done this before, it's like, no, you had done this as a project within the Mayo Clinic, but when you start to innovate across sectors and across organizations, it's a different ballgame. Why? Because what you're not realizing is that this process of design, when you're working within the organization, is actually contained inside of the guardrails of a bunch of organizational agreements that have been codified into the organization, and that blissfully, you don't need to see because you take them for granted, right? It's part of the environment that you're swimming in all the time, and so you don't realize all that the organization is already doing for you. And because you don't observe these guardrails, you focus on this work, and it seems like, yeah, I get it. When you're working across organizations, those guardrails are not there. And that was kind of like the big finding of the paper, and that's what the paper is centered on. From here on, I'm going to focus on what that means. Christine.
And so were they surprised by the recursive nature that you have on the prior slide, or that they sort of understood and it was just the guardrails that was surprising to them?
So when we went back with our findings, they were like, oh, that makes total sense. They were surprised by how their prior success, like they felt that they knew the steps they needed to follow, and as they were trying to follow these steps, it was just way messier than they had experienced in the past, and they encountered degrees of challenges that they wouldn't have anticipated. And some of it, not in their language, has to do with not like what happens when you remove these guardrails and you don't have some of these pre-existing agreements that organizations give you. And some of it has to do with the consequences of not realizing that you need an agreement and trying to follow this path without first establishing an agreement that helps you. But I'm going to come back to this, and I think it's going to make a little bit more sense, like the two types of surprises. So that's a nice way of framing, actually, and I'm going to come back to probably that same language in a second. And so what are these guardrails that can be so easily taken for granted? Well, they're the basic questions of organizing. They're a set of basic questions that anytime people have to work together, they have to figure out answers to certain basic questions, which is like, how do we divide tasks? How do we allocate tasks? How do we provide and distribute rewards and accountability? How do we learn? And how do we kind of like provide and distribute information, right? And that includes, of course, who's going to do what and why, and who's going to pay for it, and who's going to keep what after whatever we do, who's going to keep it, right? If we create value, and how are we going to sustain effort? So again, this sounds really silly when I write it in a slide. One of the most frequent surprises in these social collaborations is that people come in and they're super motivated. Everybody, right? They're all from different organizations. They're super duper motivated. They are committed to the problem. They don't realize that they still have their day jobs. They have an organization that they have to report to. And this project sits at the intersection of organizations in ways that doesn't quite fit with what you're being evaluated on. And so if you don't explicitly address the question of like, how are we going to get you to keep on working on this for 2 years? One of the most common surprises is that all of a sudden this person who was critical couldn't sustain their effort. They couldn't stay committed to the project because other stuff came up and we couldn't retain them. And so then we lost them, and so they was, right? But they were super committed. And so that's one of the surprises that comes up. Because when we're working on a project inside of an organization, the question of sustaining effort is already answered. We're all being, like our employer asks us to do this, and so of course it's okay for us to keep on working on this project, as an example, right? What does success look like? How do we learn? And a really critical one that actually Paul's work has been very influential for me is like, how do we settle disagreements? Like within an organization, even the flattest of organizations, if you read the stuff on the holacracies, et cetera, even the flattest of organizations have some degree of hierarchy for when people don't disagree. And then somebody, a grown-up, will come in and say like, all right, you can't agree? All right, this is what we're gonna do, right? And so it turns out that one of the most fundamental and critical elements that organizations do that people don't realize is valuable is the settling of disagreements. which especially in innovation projects, where there's going to be conflicting visions, ends up mattering a lot. And that was another one of the big surprises, like, oh, we all loved each other before we started the project, and then we had big disagreements, and then we didn't have a way to figure that out, right? And so again, this technology that is the organization kind of like ends up falling to the background for most people. They take it for granted until it comes up that it's not there, right? Systems, protocols, rules, routines, hierarchy, heuristics, relationships, all these things are codified in an organization when you're working on a within organization project. When you're working across organizations, rather than having this thing that runs on rails, all of a sudden it becomes uphill, right? And because effort is fluid, it is like trying to push a fluid uphill. That's the best kind of analogy that we have found, is like effort is fluid, and when you don't have the rails of an organization, how do you push a fluid upstream? When you don't have these organizing agreements at each stage, the natural outcome of joint effort is that it just drops off. With the added kind of like interesting thing is that as you move across the process, the complexity of the kinds of agreements that you need to put in place to get it to move to the next one kind of is also increasing, right? Like framing a problem with people who belong to different organizations, it's not super easy, but it has some complexity. But evaluating an experiment, like doing an experiment with people and figuring out, like that is way more complicated in terms of the agreements that you need than this, right? And so as you're moving across the steps of design, the types of agreements that people need to have in place in order to succeed become increasingly complicated. So now I'm going to move into kind of like this is why things break down, basically. These are the surprises that people had, oh, and we broke down at this stage for these reasons, and what they're describing is that they were a set of missing agreements on what they were supposed to do, and then the effort broke down for whatever reason. And so this is kind of like what we use to organize our data, and then our findings kind of come from this. Paul.
As you're moving through this process, am I guessing correctly that you've got more and different stakeholders involved, and that adds to the complexity and the risk of not making it to the next step?
Yeah, I mean, in all of these cases, people kind of knew that because they were all starting with very ambitious things, one of the things that we also didn't want, like one of the criteria for selecting cases is that we didn't want cases where it was like, oh, we didn't realize we needed more stakeholders. We didn't want that, because that's not interesting. Like if you miss the point that in social innovation you need other stakeholders, you're not that interesting to us. So in all of our cases, people knew from day one that they needed a ton of stakeholders. And for the most part, they had identified the right stakeholders. But how they integrated them and how they related to them was very different. And I'm going to come back to this in a second. But you're right that as you move up the stages, decisions that you made about how you're going to relate to these stakeholders down here become much more consequential down here, right? Last thing I'll say is that traditionally, when we're collaborating across organizations, what we use are contracts. And when it's more than one organization, usually we have a hub and spoke approach, whereas there's a hub organization that writes bilateral contracts with a bunch of spoke organizations. And that's how we usually organize these things. And that usually works relatively well for known entities, for things where you know what you're doing. Because if you think about what a contract needs to function well, you need clarity of inputs. What are you going to do and what am I going to do? You need clarity of outputs. What are you going to come up with? What am I going to come up with? You need clarity of desired outcomes. You need mechanisms of accountability and distribution of rewards. You need stability of exchange and relationships. And there's kind of a hierarchy. When you are in the world of social innovation, none of these things are there. You don't have clarity of inputs. You might have the illusion of clarity of inputs, but you don't have clarity of inputs. You certainly don't have clarity of outputs. Right? All of these things are up for grabs. And so what ends up happening is that kind of uncertainty becomes kind of like an all-defining characteristic of these partnerships. And how actors anticipate, understand, and integrate uncertainty into the process is what makes all the difference. If you designed and approach your process underestimating how much uncertainty you were going to face, you're basically screwed because you were planning for a linear process. But if you truly integrated uncertainty into how you were thinking about this, you were just much more likely to develop an effective working relationship with your stakeholders. Because kind of like what we found, again, in terms of the surprises, right? Paul, to your question, like imagine that the black circle is what we've identified as the galvanizing issue space that we want to work. And all of our actors were pretty good about saying like, okay, if this is the space, here are all the stakeholders that we need to bring. Because each of these stakeholders owns a turf in this, and we recognize that they need to be a part of this, right? And so school nutrition programs. Well, teachers probably matter a lot. Or, remediation programs, education remediation programs. Yeah, teachers matter, and schools matter, and the education ministry matters, right? And so they were all pretty good identifying the stakeholders that they needed and understanding that they needed them because each owned a turf of the problem space. What we found they all described, all of them, in very similar terms, was like, well, we identified the issue space, we identified the stakeholders, and we identified some uncertainty. But then what ended up happening is that the uncertainty we estimated, even the most pessimistic, if you want, or realistic coalitions that identified a lot of uncertainty, they all said, like, we thought it was a lot of uncertainty, and we way underestimated how much uncertainty we were going to face. Because once we started working on the issue, we realized that the problem was more complicated than we thought, and that we had underestimated a lot of the uncertainty. So that's one of the key features that kind of like they all discovered. The second thing that they discovered was, if you think about how humans and organizations plan, we can, like, at least, I haven't seen anybody who doesn't do this. We tend to plan linearly for things, right? We tend to say, like, we're going to do this, then we're going to do this, and we're going to do this, and we're going to do this. We tend to plan linearly. And in processes of innovation in general, imagine that these are two cones, right? The black cone is how much uncertainty we have, and the blue cone is how much we collectively understand about the problem. And so when we have a coalition of design, like working on a problem, we expect that we're going to start with a lot of uncertainty. We design a process that is going to help us narrow that uncertainty and is going to help us also learn together. And at some point, these two are going to cross over so that we can implement. And we begin implementing. And we're still learning, but now we have manageable uncertainty for implementation. And that's kind of how we plan for these things in general. And again, we can only plan for a linear set of actions prospectively. But what they all described was like, turns out that the first thing we did, and we realized, oh crap, we thought we were going in that direction, but actually we need to move sideways, or we need to move backwards, or we need to, like, it has to be a meandering approach of discovery, but prospectively we can only plan linearly, right? And so prospectively we can plan linearly, but once you start working on what the learning process requires you to do is to be able to kind of like meander and move in different directions, to navigate, quote unquote, these cones of uncertainty, right? And so there's two things that happen. One is that there's first an expansion of uncertainty, and then a reduction. And second is that even though prospectively we tend to only be able to plan linearly, in actuality we need to have a meandering process where we need to be able to pivot and change and adapt.
Plus, go back.
Yeah, I said that earlier on, that part of what this can mean is that there has to be some relooping, right? Sometimes this entails that, oh, this is a fundamental reimagining of the problem, how we had thought about it, right? And so the relooping is a really important part of it, absolutely. Now, because this is the nature of it, when you plan linearly, you run into all kinds of problems, right? And so, for example, on the contracting issue, I don't know if any of you ever played this game when you were kids. It's called the Crack the Whip. In Mexico, we call them coleados. And so it's called Crack the Whip because the first kid is kind of like pulling everybody around and you're turning, right, in purpose. And so usually the second kid is kind of okay. By the time you get to this kid, like, I've seen children fly off like 10 feet, right? Like,
That's a good one.
And when you plan for contractual hub and spoke relationships in an innovation process, this is what they were describing. Because I am the hub, and I have a contract with Christine, and I have a contract with Paul, and I have a contract with, right? And then you and I are working on something, and we discover that we got something wrong. It's like, oh crap, but we have a defined contract. And so now we need to rework the contract, and it's going to take our lawyers 3 months or 2 months or 1 month if we're quick. But it turns out that the contract that I had with Paul is interdependent with yours. And so by the time we figured out that we need to change our contract, and I go back to Paul and say, like, Paul, guess what? In my work with Christina, I realized that we need to, and you're like, dude, I've been working on this for 2 months now. And you, like, so now we need, right? And so as these quote unquote learnings reverberate through the contractual hierarchy, it's a mess. And the very instruments that we thought were going to help us manage the uncertainty become the straitjackets that don't allow us to learn and that don't allow us to be effective, right? And so the traditional mechanisms of organizing across organizations not only don't work, but actually become kind of like our worst enemies. So contracts don't work, and hierarchy doesn't work across organization. It has to be dialogic coordination, of course. But then the question is, what allows certain coalitions but not others to establish an effective dialogic coordination? And that's kind of like what our scaffolding, like what we discovered was, again, remember what we were doing, right? So challenges that you face at different stages, and then how did you solve them? And what we found is that the challenges were very similar. All the successful coalitions ended up finding pretty similar, relatively informal arrangements to solve those challenges that allow them to move successfully. The unsuccessful ones had very different approaches, none of which worked particularly well, right? And so that's where we came up with this model of like, oh, managerial scaffolds. Now, why are we calling them scaffolds? Because the basic challenges, again, emerge because we don't have a shared organization, and so we don't have a shared set of agreements that help us figure out how to work together. We need to come up with a new agreement of some sort. But we're not going to create a new organization. We can't, we shouldn't, that's not what we're in this for. And so it can't be a new organization, but it does need to be structural. It does need to provide stability and structure. And so it's a scaffold because it's structuring and it's structural, and it provides stability, but at the same time, it's malleable, it's modular, you can move it around and reshape it as things move, right? And you can dismantle it when you're done. And so what we found is all our successful cases deployed a set of very similar scaffolding practices to kind of like compensate for the lack of organizing agreements that provided enough structural support that people were able to move on to the next stage effectively. And now I'm going to describe each of the scaffolds that we observed. Surprisingly, I'm doing okay on time. And kind of like why they matter. And I'm going to give you some contrasting examples of what happened when it was there and what happened when it wasn't there. Is everybody with me so far? Okay, cool. So first, remember that what I showed you before, I should have had that slide here, it was like, you know, these steps as floating in space and like the effort falling. And so the first thing is, all the successful cases realized early on through conversations and some from prior experiences that you need some sort of continuous scaffolding that will contain people throughout the whole thing. And we found that in all our successful cases, there were three kind of like we call them structural scaffolding practices because they're kind of ongoing, they're present all the time, and they seek to provide a containment space for the whole effort throughout. These three scaffolding practices were convening under protective spaces, and I'm going to come back to each of them. A multivocal orchestrator, like somebody who could like orchestrate across very different stakeholders with very different languages and very different perspectives and kind of like very different backgrounds. And adaptive finance. So I'm going to describe each of them in a second. And so there were these three structural scaffolding practices that kind of provided containment throughout the whole process. And then there are programmatic scaffolding practices that emerge more kind of as endogenous solutions to the specific challenges that emerge at each of the stages. And so they're more endogenous and they're more kind of like programmatic. They're like, oh, we had this specific issue and this is how we resolved it. So convening under protective spaces. We were talking earlier about how one of the questions of organizing that people don't anticipate because of how excited they are working on these problems for example, is sustaining effort. How are you going to sustain effort, right? And one of the things you need to do to sustain effort, it turns out, is to be able to justify to your parent organization that you're spending all this time working on this project that is not directly linked to our work, right? That's one of the reasons why protective convening spaces matter, because they provide a space that, provides justification for me to engage with them. What does a convening space look like, for example? Pratam, when they're working with teachers need to do kind of like, especially when they're engaged in the design process or when they have to step away from their regular teaching jobs to spend time with Pratam, and they need to justify it with their principals who already feel like they're stretched. And so what they realize is, no, we need to create a formal task force where the teachers get a very elegant invitation from the Minister of Education and MIT and like these prestigious international, and they invite you as a teacher to come in and be in our task force. And that letter of invitation provides kind of like, we're gonna meet once every month for X number of hours. And we need, right? And so with that person can say, I'm gonna be spending this time with this project, right? And so that's one example of how that convening space is created. But convening spaces also create a convening place where while we're here together, it is clear that our identities, our incentives, the way we normally do things out there can be suspended for a bit because we're working together here. And so it creates a liminal space for kind of like exploring different ways of relating and different ways of working that otherwise would be difficult. And so another very common aspect of these convening spaces is like conferences, periodic workshops or conferences where we know we're going to meet every quarter or every 6 months, and we're going to invite a number of people. And the convener is going to be a high status enough organization where nobody has to explain why I went to that conference, right? And why we were engaging, right? And so planning that periodic space where people can come together and actually figure out things together. It sounds kind of like trivial when I explain it, but all our successful cases didn't plan for this. All our successful cases did. And it made a huge difference, right? And so again, Pratam is one organization that has learned to both have these periodic conferences, but also spend a lot of time trying to understand, for you to retain effort, what kind of justification do I need to give you? And so again, for the teachers, it's inviting you to a task force. But for academics, it may be a different thing, right? And for government officials, it may be a different thing. Contrasting Pratam versus Fuel. Fuel was this, as I mentioned, was this South African intervention that wanted to improve the school nutrition programs. The founder of Fuel was a billionaire South African who made all his money doing logistics projects. And so guess what he thought this problem was about? He thought it was logistics, right? He saw it and he was like, this is just government officials being inefficient. This is a logistics problem. And so he put together a logistics team that of course involved the schools, but the way they involved the schools was, because he was very well connected, he got the Minister of Education to approve to them doing this project for the education system. And so they tried to inform the schools and the teachers that they were doing a logistics improvement project, but they never kind of involved them. And there was no convening space for all of these actors to come together and talk about like, what actually is this truly a logistics problem or not, and to learn together, et cetera. It was all organized in a very hierarchical way, starting with the founder and his logistics team trying to impose a logistics view, which they later learned was completely wrong. This was actually not a logistics problem at all. They had completely kind of like got it wrong.
Could you give us a sense, well, maybe from Pratham, of like what kind of space? What is the space like?
So there's two things that we discovered in the process, because convening spaces and liminal spaces have been described in the literature many times in different ways, right? So Kate Kellogg's work talks about kind of actually the coffee rooms where doctors take breaks, and that is a convening space where they can take a break and actually they can explore other ways of relating, for example. And so liminal spaces can take different forms. What we learned, which I think is one of the contributions to the paper, was yes, we found in support of prior research the importance of these convening space and liminal spaces. But what we also found, which was interesting, was how the coalitions that did this well they knew that they needed to convene frequently, but each time they took a pause to say like, all right, what kind of convening do we need now? Given where we are, what does the next convening need to look like so that we achieve what we need to do? And so in some moments, it was like, oh, no, we need a conference. Because right now we're at a point where we've learned a lot, but we need to make sense of the learning. And so we need to come together and invite some external eyes to kind of probe on what we're learning. And so we need a mini conference or a larger conference. In some other cases, it was like, no, we just need a steering committee that is going to meet formally every 2 months. And they just need a meeting space, and they just need kind of like some institutional home so that they can have those periods. And those are more operational meetings, right? And so depending on what it was that the convening space needed to solve for at different stages, the convening space needed to look different. But what was constant was the need to make sure that we had a way to convene people constantly throughout. And also the adaptability of that convening space as things evolve.
So it sounds like, it's timing space, right? But
Yes.
It's like, what's the cadence? What's sort of, how do you kind of...
So for operational issues, we need more constant cadence because we need to come together and see how we're doing. But for learning cycles, the cadence needs to be a little bit longer because if we meet every 2 months, like we just don't have that much new things to say, right? And so maybe we need to meet every 6 months for that. And it takes a different shape.
When we first started talking and you used the example of the nice invitation from the high status people as a justifying, I was thinking it didn't necessarily mean space per se, but it sounds like you really do mean like a space. So it's not, not just a convening cover or
no, like because the teacher, in order for the teacher to truly deliver what we need from the teacher, we need the teacher here with us. And we need to be able to, we need to figure out what the cadence is for being able to bring the teacher to us with enough frequency, but that we get the value, but also with not so much frequency that it becomes unworkable for them. And so the teacher, for example, that would be kind of like a typical thing of like a task force. Like we have a task force and you're invited to that task force, and that's what that containment space looks like. And it's an organizational space because it's a task force, but it also needs a physical space to exist, because if we don't have the physical space, it doesn't happen. Especially back then. Maybe now it would be different with, how we've become used to remote work, but during our cases, there was no such thing. So that was one of the structural scaffolds. The second one, which was critical, is kind of like multivocal orchestrating, right? This idea that we need a broker, a translator, a mediator, because each of these stakeholders is actually very different, and they all have very deep expertise, but they also have almost ideological commitment to their view of the world, and they need to collaborate, and they don't often understand, often the same word literally means different things to them. And often, the definition of evidence, going back to your question about control groups, for many of them, the definition of evidence is actually different. And so if you want to be evidence-based, but you believe that case studies about implementation are the most valuable things, and you believe that RCTs are the only thing we should believe, and we need you both to work together, that's hard. And you need somebody to be able to help mediate and translate between the two. And this, again, going back to the role, actually a lot of people have done work on brokering organizations and brokering people, mediators, translators, etc. And so on the one hand, that's not surprising. We in the paper, we talk about how this is supportive of other research. But what we found that I don't think has been described enough in the past is that, yes, these people needed to translate, but also because they're the only ones who understand everybody, they end up needing to play a really important project management role. And I believe that in work on social innovation, the role of the core project manager has been grossly described. And the importance of the project manager being multivocal so that they can assess the needs of the different stakeholders at every moment and then determine what is the most needed scaffold at this moment becomes really, really important. So our multivocal orchestrators were, yes, translators and mediators, but also they were the ones who were figuring out what kind of organizational agreement do we need now, and then how do we get that to happen? And so, again, talking about, for example, contrasting two cases, Progresa, these are the two Mexican programs. In Progresa, interestingly, the president, in both cases, the president was driving these things, which is why we thought they were comparable cases. The president was super excited and super committed, and so it wasn't like there was not enough leadership support. In one case, however, the president had come from academia before, and then from policy evaluation, and so he was very committed to evidence. And he put together this kind of like coalition of academics and policymakers and local governments versus state governments to work together. And he was an amazing translator. And of course, he couldn't do project management, but when he chose the project managers, he was very careful in picking somebody who could really translate across, right? Whereas in the case of Programa Primer Empleo, the president, again, who was very much, he chose somebody who was an implementer. It's like, this is my priority program, we can't screw this up. I want somebody who's like an amazing implementer. And it turns out that you didn't need an implementer because there was a lot of uncertainty, right? And Programa Primer Empleo ran into a lot of problems because of underestimation of uncertainty. So that's a second of the, yeah, of course.
So thinking about like what are the attributes of these conveners and orchestras? So there's in collective impact, you might have backbone organizations that are sort of the facilitators. Like Woody Powell's stuff on innovation, you've got these anchor tenants. But those are like universities, like NIH. That doesn't feel like it has a project management sort of aspect of it. So I'm trying to think about what other, in other literatures, like, so this seems like it could be a backbone organization. Could sort of
yes, but I think it needs to be a backbone organization who can be close enough to the implementation, because implementation is a part of this.
Yeah.
And so all our successful multivocal orchestrators were kind of like high enough that they could be seen as neutral and with convening power, et cetera, but also close enough to the operations and the implementation that they could really translate across the different stakeholders in implementation as well. So the president in Progresa, the president purposefully said, like, this can't be in my office because then nobody's gonna wanna say when things are going wrong. And so he purposely pushed it down a little bit because he thought it was much better in a lower level ministry, purposefully, right? Whereas in the instinct in Programa Primer Empleo was like, this is gonna be from the president's office and we're gonna check in every 2 weeks, and then that's actually one of the things that ended up derailing it, right? And then a third critical structural scaffolding practice was like adaptive financing. And again, this is one of those things that when I say it, it's like, yeah, duh, of course. But actually, when you go back to the literature, like there's actually very little description of what are the financing arrangements that you need. And of course, money matters a lot for all of these things. And how you structure your financing ends up really affecting things. Because the natural tendency and trajectory of financing in international development has been towards accountability, to the question of accountability. And how do we make sure that you're accountable? And the way they've traditionally defined accountability is kind of like what I was talking about in contracts. Like, ex ante, tell me what your theory of change. Show me your theory of change. I teach this stuff, right? Show me your theory of change. What are going to be your inputs? What are going to be your outputs? What's going to be your outcomes, right? But for things that are well known, that works really well. But for things that are not well known, that works really poorly. Because if you've structured your financing around inputs, outputs, outcomes, impacts, but you need to be pivoting, then your financial structure becomes a really kind of like a straitjacket for learning, right? And so structuring financing agreements, what we found was that our successful cases, they were able to structure financing agreements that were built for learning, that were very flexible in the terms. But at the same time, the trick was that they couldn't be too flexible, meaning there needed to be accountability, but the accountability needed to be to learning. Like, you need to show me that you're learning and that you're learning what you said you were going to learn, because if not, I am going to pull my funding. But you do need a flexible structure. And so again, Pratam is a really interesting case because they described how they learned from a really couple of bad experiences early on. And when they're negotiating, they can have a donor who comes in and offers them millions. They're a well-known organization now, so they offer millions of dollars. And when they start negotiating, if they see that the donor is kind of like one of these like, no, show me, they're like, no, but we're learning. And if they see that the funder is too rigid, they're like, you know what, this is not going to work out. We're actually not interested in this grant. And they showed as example of grants that they've turned down because they couldn't negotiate flexible agreements with the funders. And in the paper, we describe a number of cycles where Pratham kind of like thought they were doing this, but actually they learned that that wasn't the right idea and went back to their funder. The Hewlett Foundation, for example, is good about financing for flexibility. But like, you know what? We had planned for this deployment, but now we're going to do this. And Hewlett was like, sure. And in that, which is really odd for a financier, the Hewlett accepted money back, which they hate doing, right? They have a hard time deploying capital, and so when they never want to get money back. But Pratham said, like, you know what? For this next stage of learning, we actually need a smaller amount of money, and then maybe we'll get it back for the next stage. But we realized that we didn't need to scale that quickly. We need to do a different thing. It's described in the paper. PPE was the, like, again, going back to the Programmatic Empleo, this president-driven thing, because they were so committed to scaling quickly. They were like, all right, we need to put in the federal budget, right? And so from day one, they were like, all right, we're going to inscribe this project through Congress. We're going to pass it with like program laws and regulations, et cetera. They put it in the federal budget, and it's the same in the US. Once you have something in the federal budget, you are screwed, because there's kind of like a set of regulations that say very explicitly what you can and cannot do with the money. And so basically the space for learning becomes zero. And one of the interesting features about Programmatic Empleo is these actors saying, like, by year 2, we knew this wasn't working. But now, by law, we had to execute the funding. We had to. We would be committing a crime if we weren't spending the money. And so we were spending money on things that we absolutely knew weren't working. And we kind of knew the tweaks that we needed to make, but we couldn't, because by law, we had kind of like established in law that we couldn't do this. This is the most stringent version, but other cases describe that they had like not quite as strict because it wasn't laws, but financing agreements with their donors that had this kind of like input-output feature to them. And so it was like, that was very rigid and we couldn't adjust. So those are the 3 kind of structural scaffolding practices, and I'm going to go quickly through the programmatic, right? The things that emerged to solve the challenges as the design process was unfolding, and they were kind of like more endogenous and more ad hoc. Negotiating a shared problem, establishing a learning orientation, distributing expertise, negotiating currencies of exchange, and mapping learning pitches. So those are the practices that we observed all our successful cases deployed at different stages. Negotiating a shared problem turns out to be a big deal. We all have the same galvanizing issue, and so we tend to imagine that we are talking about the same thing, but the metaphor of the blind man and the elephant actually works really well, and I'm sure you all know it, so I'm not going to go in depth, but it was really interesting. I've observed some of these, and I've had to run some of these because of my work on violence intervention, and it's really interesting when you bring all the people in the room, and you're like, all right, so what is the shared problem? It is really interesting how you have this phenomenon of everybody describing the part of the elephant that they've kind of worked on for all their lives. And the importance of having a facilitated process, like Pratham has become really good at facilitating a process where it's like, all right, I'm going to help you all come up with a shared definition of what the actual problem is that we're focusing on. And it needs to be facilitated because we actually need to not just define the problem, but also define what are our shared values around this problem. It's very easy to be very committed to our methods, but when they push us to agree on what are our shared values, usually that pushes all the actors to move one level above from what they had been doing to actually we all care about the same people. And our shared values are usually around the people who we're trying to help. And once you establish those shared values, it creates a mechanism for coordination and for disagreement resolution that is really, really helpful. And so when you've negotiated shared values, and then in 2 months we're disagreeing about a mechanism, and I've seen this, for example, in the Mayo Clinic, that's where I first learned this. When they're disagreeing about something and somebody says like, all right, what's the best thing for the patient here? It's really powerful how everybody takes a pause and they're like, okay, actually, I guess you're right. If we're thinking explicitly about what's better for the patient, you're actually right. And so that shared value helps kind of like, but you need to establish that up front. If you don't have it, then it derails collaborations. A second really important scaffolding practice is establishing a learning orientation versus an implementation plan, right? And so again, thinking about Progressa versus PPE that I've talked about already. Progressa, from the beginning, the president said, like, listen, we have hunches, but we don't really know. And so the goal of this program for the first 3 years is just to learn. And we're not implementing at scale fully nationally until we learn. And that's, so the orientation of this whole thing is to learn. Whereas in Programmatic de Empleo, from the beginning, it was like, we need to implement well, right? The fuel case that I described on children's nutrition, these logistics people was like, all right, we need to implement a logistics kind of improvement, and it got derailed because they didn't realize all that they needed to learn before they were able to deploy. And so again, this is another facilitated process where all the stakeholders need to be in the room, and the multi-vocal orchestra that facilitates an approach where they say, all right, let's talk about what we all know, but let's talk about what we don't know. And so they start, one of the ones that I've seen is like, they go around the room, tell me all the things that you don't know about this problem. And once they do that and they see on the board all the uncertainty that they have, everybody's like, oh crap, like actually there's a lot that we don't know. And they all become much more humble through the kind of explicit identification of uncertainty. And this helps set an orientation, a learning orientation that then, of course, affects everything else. And then a third really important programmatic scaffolding practice is distributing expertise. And I think for those of you who know this movie, you know why I'm showing it. I think this is a great example of distributing expertise, right? It's like, and distributing expertise is like, once we have identified uncertainties and the different levels of this problem, then if I'm designing a remedial program for kids in school, I explicitly say, Christine, you're the teacher. We are going to defer to you on decisions about what happens in the classrooms. But I'm the budget person. And so when there's things about the budget, you're going to defer to me on budget. And Paul is the organizations person. And so whenever we're making decisions about how to organize these things, we're going to defer to Paul, right? And so there's this very explicit process, like after we've identified uncertainties and kind of like the learning orientation, there's this very explicit process of saying like, all right, who are we going to defer to on the different decisions, and how are we going to distribute expertise across our stakeholders? There's a reason why we're all here. Let's be explicit about who's going to get more say on different aspects of the problem. All our successful cases did this very well. All our unsuccessful cases did not do this well, right? And so, for example, in Aqua Plus, Tara had an amazing track record of designing business models for distributing things to underprivileged populations. When they were designing Aqua Plus, they thought they had all the expertise they knew. They designed a business model, but they didn't really integrate or consult with shopkeepers or with kind of customers. And they underestimated that what was different about this technology was that it really needed to change the habits of families, like every habit, basically. And so if you didn't understand their habits, like it didn't matter how good the product was. They thought this was a product and distribution problem, where actually it was more of a habit change problem than a distribution problem. But they framed it as distribution. They didn't properly distribute expertise to their shopkeepers and community leaders. Again, if contracts don't work, what does work? Really interesting, all our successful cases had a very explicit process of pricing currencies of exchange. And what do I mean by this? And I've learned to do this. When I'm collaborating with a police organization, and they're like, all right, that's cool, like we're working on something together. And I now learn to be very explicit. It's like, listen, if I can't get a publication out of this, it's gonna be really hard to sustain my commitment to you. And so we need to negotiate a way in which I can get enough data that I can get a publication out of this at some point. It doesn't matter when, but at some point. And if you want an academic engaged, because they're valuable, you need to figure out how they're gonna turn this into a publication. Politicians, in the well-executed negotiations that we learned about, they were like, no. The politician was very transparent in saying, like, listen, I have elections coming in 2 years. And I need to be able to talk about this in a way that makes sense. And so I'm going to need your help in talking about this in a way that makes sense, because otherwise this could derail my election. I'm taking risks here, right? And so they were very explicit about what do you need to get out of this so that you can stay involved. And they negotiated those currencies of exchange. And in the paper, we have kind of like all the dimensions that we saw kind of like were explicitly negotiated on. Different people have different timelines. My publication cycles are very different from an implementer's funding cycles. right? And so we need to figure out how do we map those to each other. And then finally, and this is maybe my favorite one, is this idea of mapping learning pitches. Are any of you rock climbers? Kind of. Well, this I learned from an RA who's a rock climber, and he was explaining that when we were describing what these people were doing, the successful cases, he was like, oh no, that's just like rock climbing. It's like, what do you mean? It's like, well, when you're gonna do a complicated climb and you're down here, you can see this pretty clearly and you know you wanna get to here, but you don't really know what's gonna happen in the next ones. And so you map what are called climbing pitches. And the pitch is defined by the length of your rope, right? And so basically you say, okay, we know we can get to here, and then once we get there, we're gonna bring up the rope, we're gonna take a pause, we're gonna take a break, and then we're gonna see whether our hypothesis that this was gonna be the second one is the right pitch, or whether we need a different pitch. And so this idea of mapping learning pitches is something that all our successful cases did, which was like, all right, given all the uncertainty that we have, what question can we tackle first? And then we will reconvene. And then we will determine what's the next question, and then we will reconvene. And so this idea of rather than mapping a full linear implementation to the summit, recognizing that actually we don't really know what's going to happen beyond the first one. And so let's just agree that the first one is going to be this, and then we're going to reconvene, and then we're going to agree on what the next one is. To your point, Paul, about the cycling nature of these things, all our successful cases did this. They mapped these learning pitches on like how much uncertainty can we tackle now, and then we'll figure something out, and then we'll tackle a bigger amount and a bigger amount. And so what these scaffolds allowed to do was, if you notice, we purposely thought that this was a nice way of representing the scaffolds because it's kind of like these relatively informal and relatively organic elements that you put in place so that the different stakeholders can weave their efforts around it in a somewhat organic way, because it needs to be that way. It can't be very structured, it can't be very formal. It has to have some sort of informality to it. But when we saw all our cases that deployed them, they were very successful being able to kind of like bring actors through all the different stages, and of course the recycling that Paul was mentioning. So that's it, that's the paper, it's the paper in the book. That's what we are learning, and that's where we are. I have the generous amount of 4 minutes for, 5 minutes for your reactions, your disagreements, your questions, and your ideas about what else you would want to see. Thank you.
So I'm thinking about the distinction between mapping learning pitches and learning orientation. So is the pitch is about the distance that you can see, and the orientation is just sort of an idea around that's what we're trying to do.
The orientation is kind of like earlier on, because the orientation is like, we're not implementing here. Mm-hmm. We are learning here. And let's all get in the right mindset that this is a learning partnership. This is not an implementation partnership. Because think about implementation, right? Implementation, you start thinking about accountability and contracts and hierarchy and like all these things. It's about efficiency. Learning is about learning. And so establishing the learning orientation is about making sure that everybody's on the same page about what the tone of the collaboration is and what the general approach is going to be. And for example, that really matters when you're thinking about, when you combine that with negotiating financing. If you don't have a learning orientation, you're probably going to screw up how you negotiate your financing. Whereas if you have a learning orientation, you're going to be much more mindful in how you negotiate your financing, right? Whereas, as you say it correctly, learning pitches is more about, all right, now that we know we're going to learn, there's all this uncertainty, how much are we going to tackle first? All right, we're going to tackle this amount first, and this is the first stage of this is the first thing we need to learn. So as an example, Progressa. When they were trying to figure out, they were like, all right, it seems like there's some evidence for conditional cash transfer programs. So maybe we need to do a conditional cash transfer program. All right, first question, should it be conditioned or not? Well, we don't know. All right, let's do that experiment first. Let's first set up, what are the kinds of incentives that we need to work with families? Because before we get into questions of how we implement this at scale, we need to get the incentives right. And so they first ran a bunch of experiments with like, how do we get this to work for families? What kinds of conditions are better than others? And then once they figured that out, then the next question was like, all right, how do we distribute locally? How do we negotiate with local governments on how to distribute this, right? And so then they ran a slightly larger experiment, and then a larger experiment, and a larger experiment. In many cases, like the uncertainties are nested, like what I just described, right? And so you can figure out once you start talking about it, people can start imagining like, oh, I do see the nesting. And so, but if you miss the boat that you are working in a world of uncertainty, then you're off on a different path.
Really kind of interesting stuff. I had kind of a question about like the form that kind of these contingent agreements take, right? So with a contract, right, between people, you can say, well, here's the contract, right? Or in a hierarchy, here's the policy. Here, it feels more open-ended by design, by need, right? So, you know, are we talking about, okay, we've come up with a common language, or, you know, how do we know when we've got some kind of a contingent understanding?
Usually the way these things work, so I'll tell you the formal and then the informal, which is what actually you're asking about, but the formal matters. Going back to Christine's question, and actually this is not in the paper, but we can't fit anything, but it will be in the book. Usually you have a parent organization that is the one that's receiving the budget, right? That negotiated or like that is the recognized as the one who's going to receive all the budget and distribute the budget. And they're kind of like, they're on the hook for managing this thing. And they're the ones who need to be deciding how we're going to organize and how we're going to convene and all these things, right? And so in our successful cases, that anchor organization was an excellent multivocal orchestrator and then figured out how to do all of this. That's the formal aspect. But then within that, what you had was, in the successful cases, was actually pretty informal agreements that almost all of them ran on trust. It's like, you've told me what your currencies of exchange are, and you need to trust me that, you know, you've told me more or less how much budget you would need to kind of do the things that we're imagining you're going to need to do, but we're not specifying it in a contract. Maybe we have kind of like a fee per service kind of agreement where I'm going to pay for your time as we go. And so we have a mechanism for me to pay for you and distribute funds towards you, but it's a very informal agreement where actually you have to trust me, because if at some point I'm like, guess what, we're not going to do that. Like I could totally cut you off. And so you need to trust. And so it's agreements and promises. It's informal agreements and like, all right, this is what we agreed we're going to do. This is what we're going to learn now. This is the role that we all agreed we're going to play in the next stage. And so I'm going to pay you each as you bill me for your time. But only much later in the process will we actually have a contract where you're committing to specific kind of like implementation metrics. It's usually much more informal, open arrangements that have some formal mechanism so that I can pay you, for example, but have very little kind of specified things on paper.